I was asked by the production team of called the Midwife to give them some advice about what treatment would have been like for a baby born with a cleft lip and palate in the East End of London in the mid-1960s. I was working a little after that as a very junior doctor at Great Ormond Street, treating some, or being involved in treating some children with clefts, and then a little later at the London Hospital in Whitechapel. So I was around not long after that time. And there's no doubt things have changed a lot since that time. There have been some major changes in techniques. There have been changes in how cleft teams work together. Now it's much more a collaborative effort between speech therapists, orthodontists, other specialists and surgeons, whereas then it was the surgeon who was the king. And there's also been centralisation of cleft services in the UK, so that all the centres are major centres. However, we still have a long way to go, and our charity Cleft is involved in two ways really. In research, we're trying to find more about the causes of clefts and potentially how they could be prevented in the future. And we're also looking at outcomes and ways of improving outcomes. And that's another change that's happened in the last 50 years, that we are now looking at outcomes. We are critically evaluating outcomes, and we're learning more, but there's still a lot we can do to improve the end results for all the patients born with clefts in the UK. In the developing countries where we are involved, in Bangladesh, Sri Lanka, Egypt, Kurdistan, Uganda, it's much more like things were in the 1960s in the UK or even earlier. And we are helping them to try to lift their standards to something like what can be achieved in the UK.